I'm Kate Blake, and as one of the co-founders, I'd like to introduce you to the Edith Foundation. This foundation aims to prevent the abuse and neglect and social isolation of people in nursing and care. We really understand the struggles care providers have in delivering care, and we also recognise that current integrated care systems cannot guarantee a safe delivery of care.
We need the foundation because, in my opinion, the way the Care Quality Commission does things at the minute isn't working. There's just too much neglect and abuse in care homes continuing all the time, going not picked up on.
Well, I think that the care system needs to be changed by setting up within every care home organisation the sort of programme that Kate has developed.
This foundation truly believes that the provision of outstanding care should be the objective of every care provider, and the receipt of outstanding care should be the right of every individual that needs it.
The values of the foundation is almost like looking within ourselves. It's the holistic part of it, what the foundation stands for, the integrity, the trust, the way that we can go in there and change things for people's lives.
My partner had a huge stroke in 2006. He was fine up to the day it happened. Obviously totally changed both our lives. My property wasn't really suitable to get him home, so he finally went into a care home. Within 2 weeks, they were keeping him in bed 22 hours a day. He wouldn't get him up. I was visiting every different time of the day to try and see if he was up at different times. You start doubting that you're complaining about things that maybe aren't, the norm, if you like. You can go to residents' meetings like we did down there, but unless you pick up with somebody else who's on your wavelength at those, it's very hard. People visit, they go into their own little rooms for the people, and no matter whether they're complaining, you're complaining or whatever, you never get that bond that's stronger to do it with a few of you rather than one-on-one. So you do feel very isolated. And obviously a foundation that you can go online. I mean, I've read loads of stuff online, but again, if you can actually even phone up or speak to them, even if it is in another town or whatever, you don't feel you're on your own so much.
I think a big problem in care with employment, is the minimum wage that they're often paid for the work that they have to do. A big problem actually you often find is treatment that the staff get from the managers. If there's a big high turnover, why? Because quite often it's because they're not happy with the care and they're not treated very well, not listened to by managers. Also, they don't have a realistic point of view. Say for a nursing floor, you have 20 patients, 4 carers if you're lucky. Now that gives on average 15 minutes per patient just to get them showered, tidy their bedroom, and it's just not possible. You can't give proper care in such a short space of time.
I'm a carer for my wife, Marion. She went to one hospital for a water infection, and she would just push to one side, satisfy myself, go up there every day to make sure that she was being fed and all that. Then all of a sudden, Mar complained about she was frightened. She's never said that before. And I said to the nurse, "Do you shut the doors and lights?" "Oh no," she said, "we leave the lights on and the doors open." So I secretly put a camera in there, and the things you saw on there, you open your eyes. They give her tablets, and they just pushed it in her mouth and laid her back down without no water or nothing. Then another night, I wouldn't come in to feed her, and where she was shoveling it into her mouth, she couldn't get it in there fast enough. And then to finish, she got hold of her hand and pushed it in with her hand where she couldn't swallow it fast enough. I myself now, I don't trust no hospitals at all. I don't.
I think the cause of neglect is poor staff morale in the first place. You need excellent leadership, and I've noticed this in all walks of life. If you've got a good leader, then the rest follows.
Many of the care homes I've left is because I've spoken to managers to say patients are not getting the care they should be, and being told, well, it's not going to get any better than this. If you don't like it, you know where the door is. The outcome we want is that people are going into care and they are being genuinely cared for, that the families of those going into care know that when they leave their loved one, they're not going to be worried about what we're seeing on TV, what we're seeing on cameras, because actually the sad principle of the thing at the minute is the only way you will ever know that a loved one is safe is if you have them at home, or if you do have often surveillance cameras.
The Foundation's vision of promoting kindness is practical and it's supportive. The Kindness Audit and the Individual Development Programme for care providers are based on sound and methodical principles that identify, celebrate and share good care practices.
We've seen good care, and it's amazing just what you can do with some kindness, some love, some conversation with people, just to spend the time with them to see how you can improve their lives.
We don't say we have all the answers, but we do believe, however, that we have all the fundamental tools, the essential core values and the strategies and policies that will actually make a difference to all the outcomes in care at the moment.
The Edith Ellen Foundation, they will have a bigger impact because they're getting everybody together, they're supporting, they're communicating. It's not just about the patients, it's about the training, getting the staff that do actually care, not that want to do as little as possible, and they support everybody. They go right the way through the home to find out what is breaking down, why, what can be improved, and getting that quality of care for the patients who are paying for that.
This programme brings benefits for everyone. For the people receiving care, their voices will be heard. At last they will have choices, they will be actively consulted and given guaranteed safety and involvement in leading their own independence, well-being, self-esteem and individuality. For the care providers, they will be united, they will be valued and respected and motivated. Understanding the difficulty in the marketplace at the moment for our care group chains, we will gain them reputation, trust, long-term growth, sustainability, profitability for themselves and their shareholders. The benefits for all our CCGs, local authorities, integrated services and the connected charities and organisations. Kindness in care is value for money and cost saving, and it will show achievable reductions in pressures and costs on their resources and year-on-year growth in their better outcomes and increased incomes.
The positives of the foundation are that we want to help with staff attitudes towards care, management attitudes towards care, to help them realise the potential of having a good name for their home, of having, oh, that's a good home, you know, my mum, my dad was cared for there, and they really enjoyed life and they focused on actually what they can do, not just what they can't do anymore.
I shall never forget my mother saying, just before she died, that the last 4.5 years in an excellent nursing home where she was were the most contented that she'd ever had. And I think that's how every old person should be able to live out their last years.
It's not just about patients, it's about their families, the staff, it's supporting everybody, and you can't have good care unless everybody together works towards that.
The Edith Ellen Foundation is the best news for a long time in the care sector.
The Edith Ellen Foundation doesn't think it has all the answers, but what we do believe, we've got something here that will support everybody and give you the type of care that you want, your loved ones want, and our future generations need.